breathe. I'll take a nice breath in. So it's my order here is like I breathe in, I try to push my belly against the ball, and then as I breathe in more, I'll start to feel my upper back expanding. What's up, guys? Dr. Chris here. What we're gonna go over is a drill or an exercise that I really like giving my patients for a lot of reasons, and we call this an exercise ball bear hug. If I had to give like 3 reasons why I would give this to somebody to help them in some way, I'd say the first thing is a lot of patients complain, people in general complain of discomfort, tightness, dull ache, whatever, around the shoulder blade, kind of upper back, usually favoring one side. So at the end of the video, I'll kind of explain quickly what I think that is really. But the feeling of needing to stretch the muscles in our upper back, and a lot of people want to do that, but they don't know how to do that. So this is a good way for that. So aka it's kind of a rhomboid / middle trap stretch. Number 2, and this is for more of joint mobility, is scapular protraction, or the ability to wrap our shoulder blade around the back this way. That's something that a lot of people struggle with. So this is a good way to not only mobility-wise work on that, but get people to feel what that sensation is. This is crucial for muscles like the serratus anterior. Thirdly, number 3, for why I would do this, and this is why I like to do it, when it comes to good respiration, good breathing, especially with our diaphragm, on your initial breath, you want to get expansion like through your abdomen, right? And the whole thing, the whole canister there. But the deeper we breathe in, we want our rib cages to expand as well. And a lot of people struggle to feel how to like fill up the lungs and feel a good expansion in the upper back. So this is a great way to help. What we're going to use is an exercise ball, obviously, and I'm using a smaller one here. You can like medium, the large size, it really doesn't matter. But the smaller the ball, then you can have a little bit more mobility. I'm gonna wrap my arms across, and just by doing that, I'm getting a little bit of flexion in my upper back, which a lot of people surprisingly need. And then my shoulder blades, I really want to feel them protract, or basically wrap all the way around my rib cage as much as I can. From here, I will just breathe. I'll take a nice breath in. So it's my order here is like I breathe in, I try to push my belly against the ball, and then as I breathe in more, I'll start to feel my upper back expand a bit. So breath in, and then out, in, out. Now I always want all the air out. So then once I get the hang of that, I can actually bias one side, and what I'm doing is I'm just kind of rotating and then flexing over the ball. Now I'm getting a nice full stretch kind of through the shoulder blade muscles, upper back there. And then in that position, same thing, I'm going to work on breath. One thing that helps is as you go and you kind of flex, rotate, breathe in, and then as I let all that air out, then I might try to go a little further. And by the way, my arms are totally relaxed. I'm not squeezing against the ball. You can see I've got my fingers clasped. I'm literally just trying to hold the ball in place with minimal effort from my arms. I'll say when we really want to look at why people have that kind of dull discomfort there or tightness, I think it's usually one of 2 things mostly. First thing would be it's a referral from your neck. So it's kind of like a disc problem or issue of some sort. And it's referred your pain to the shoulder blade. Okay. Number 2 is it's more of a ischemia, or it's essentially you need more blood flow to the area, or you're weak. I mean, it's kind of the best way to put it. And so there you have it. We got exercise ball, bear hugs. Go ahead and give these a try. Let me know what you think. Go ahead and subscribe to my channel, and I'll see you on the next one.